Welcome to our video on bacterial vaginosis, Candida Vulvovaginitis, and Trichomonas vaginalis. Let's get started. Now here's the overview figure that we'll be using. So let's start with bacterial vaginosis. Bacterial vaginosis is caused by Gardnerella vaginalis and other anaerobic bacteria that overgrow in the vagina. Bacterial vaginosis is related to sexual activity, but it's not sexually transmitted. The reason for this is that vaginal intercourse disrupts the normal vaginal flora, allowing the overgrowth of Gardnerella vaginalis. And something important to know is that bacterial vaginosis increases the risk for preterm delivery in pregnant women. And risk factors for developing this infection include vaginal douching that also disturbs the normal flora and a woman having sex with another woman. Now, symptoms include painless, thin gray vaginal discharge with a fishy smell. And moving on, let's talk about the diagnosis. Now, bacterial vaginosis is diagnosed by 3 or more out of 4 Amsel criteria. And these criteria include a vaginal pH of greater than or equal to 4.5, in the presence of a thin gray-white discharge, a positive whiff test, and clue cells seen on a wet mount. So let's discuss the positive whiff test. What is that? Well, when vaginal discharge with fishy smell is then mixed with 10% potassium hydroxide, then that chemical reaction exacerbates that fishy smell. Now, as for clue cells, those represent Gardnerella vaginalis surrounding vaginal epithelial cells. And finally, bacterial vaginosis is treated with either metronidazole or clindamycin. Here we see a classic appearance of a clue cell under the microscope. And note that peripheral stippling around that vaginal epithelial cell representing the bacilli of Gardnerella vaginalis. Now moving on, let's discuss Candida Vulvovaginitis. This is caused by Candida albicans, and risk factors for this infection are diabetes and recent antibiotic use. Now, diabetes mellitus causes glucosuria, which causes perineal and vaginal overgrowth of Candida, and recent antibiotic use kills the vaginal lactobacilli, allowing for Candida overgrowth. Now, speaking of signs and symptoms, Candida vulvovaginitis is characterized by thick, cottage cheese discharge and painful inflammation of the lower reproductive tract. Now, a painful Candida infection is in contrast to bacterial vaginosis, which, as we already explained, is painless. Now, here we see the thick cottage cheese discharge and yeast cells with pseudohyphae on microscopy. Now, as for the treatment, azoles are preferred, and these can either be oral or topical. For example, topical fluconazole. Now, this is a photomicrograph showing yeast cells and pseudohyphae. Those are the classic findings of Candida albicans. Moving on, let's now discuss Trichomonas vaginalis. Now, Trichomonas vaginalis is a sexually transmitted protozoal infection. Therefore, the risk factors include multiple sexual partners and unprotected sexual intercourse. Now, speaking of signs and symptoms, Trichomonas vaginitis is characterized by yellow-green, frothy, foul-smelling discharge and painful inflammation of the lower reproductive tract. Pain caused by Trichomonas vaginalis is in contrast to bacterial vaginosis, which is actually a painless infection. Now let's talk about how you diagnose it. Now, Trichomonas vaginalis infection is characterized by a vaginal pH of equal to or greater than 4.5 and yellow-green, frothy, or foul-smelling discharge on physical exam. Inflamed cervix with punctate hemorrhages seen in trichomonas infections is sometimes referred to as a strawberry cervix, and a wet mount will show motile pear-shaped trichomonads, and the nucleic acid amplification test, NAAT, is the preferred confirmatory test for trichomoniasis. Now, as for the treatment, metronidazole is the preferred agent, and please keep in mind that metronidazole should be administered to the patient and the patient's partners to prevent the patient's reinfection. Now, this is a colposcopy image showing thick white yellowish discharge, and it's characteristic of a Trichomonas vaginalis infection. And this is a photomicrograph showing motile pear-shaped trichomonads, which is characteristic of Trichomonas vaginalis. So now let's do a brief question. A 34-year-old female comes to the physician due to severe vaginal pain and discharge. She is sexually active with 4 male partners, and she takes oral contraceptive pills. Her vital signs are significant for the temperature of 38 degrees Celsius. The physical exam reveals yellow-green vaginal discharge. The wet mount shows motile pear-shaped microorganisms. What's the preferred antimicrobial agent for this patient's condition? Okay, so based on the patient's symptoms, they've got a fever, yellow-green vaginal discharge, multiple sexual partners, and does not use barrier contraception, and you see that characteristic pear shape on the wet mount. So all of that is consistent with Trichomonas vaginalis. and the preferred antimicrobial agent is metronidazole. Now here's the table summarizing the 3 causes of vaginal infections that we've discussed. So I would suggest referring back to this so that you can help compare and contrast these similarities and these differences of these various pathologies. Now let's just wrap up with one question. A 29-year-old female comes to the physician due to vaginal itching and discharge. She started having symptoms 5 days ago. Her past medical history is significant for gonococcal cervicitis 3 years ago and atypical pneumonia treated with azithromycin 2 weeks ago. Her vital signs are unremarkable. The physical exam shows thick white vaginal discharge. Microscopy shows yeast cells and pseudohyphae. What predisposed this patient to her current condition? Okay, so this patient has thick white vaginal discharge accompanied by those microscopic findings of yeast cells and pseudohyphae. So this is classic for Candida Vulvovaginitis. And she was treated with azithromycin 2 weeks ago, which actually likely disrupted her normal vaginal flora, allowing for Candida overgrowth. Therefore, recent antibiotic use most likely predisposed this patient to her current condition. And that concludes this section.